The shrill ring of the phone cut through the night, piercing the silence like a knife. Dr. Arjun Sharma fumbled for the receiver, his heart already pounding. It was past midnight, and he knew that calls at this hour were rarely good news. Calls at this hour never brought good news. His mind raced through the possibilities, each more dire than the last. "Dr. Sharma speaking," he mumbled, his voice thick with sleep and concern. "Arjun, it's Vijay," the voice on the other end said urgently, cutting through his grogginess. It was Dr. Vijay Kumar, the city's health commissioner, and his tone was grave. "We have a situation, a potential outbreak," Vijay continued, his words sending a chill down Arjun's spine. "I need you at the Metropolitan Hospital, immediately." Arjun's mind raced. An outbreak? Here? In his city? He had seen the reports, the rising numbers of monkeypox cases in other parts of the world, but he had hoped it wouldn't reach his city. The thought of it now being a reality was terrifying. "What's the situation, Vijay?" he asked, trying to keep his voice steady despite the anxiety gnawing at him. "We have 2 suspected cases," Vijay replied, his voice heavy with concern, "both presenting with high fever, swollen lymph nodes, and pustules." Vijay's voice was grim, each word adding to the weight on Arjun's shoulders. "Get here as fast as you can, Arjun," Vijay urged. "We need to act quickly." Arjun knew the gravity of the situation. Every second counted. He had to move fast. Arjun hung up the phone, his mind buzzing with a mix of fear and determination. He couldn't afford to waste any time. He knew this was just the beginning. The city was counting on him, and he was ready to face whatever came next. The air in the hospital room was thick with tension. Every breath felt heavy, laden with the weight of uncertainty and fear. Arjun pulled on a surgical mask, his eyes scanning the 2 patients lying listlessly on the beds. He could feel the gravity of the situation pressing down on him. Their bodies were covered in the telltale rash, painful, pus-filled blisters. Monkeypox. The sight was both familiar and alarming.
"We sent samples for testing, but clinically it's a match. The lab results will confirm our worst fears."
Her face, usually bright and cheerful, was etched with concern. The weight of the potential outbreak was evident in her eyes.
What's strange is the presentation. It's unlike anything we've seen before. The symptoms are more severe and the rash is spreading faster than usual. It's as if the virus has mutated. This seems to be a different strain of monkeypox, clade 1b, highly transmissible. The implications are dire.
Arjun felt a chill run down his spine. The realization of what they were dealing with was overwhelming. A new, more contagious strain. One that could spread like wildfire, if not contained. This was bad, very bad. The potential for widespread infection was high. The potential for a full-blown epidemic was real. The stakes had never been higher. They had to act fast and decisively to contain it. The fight had begun. Every second counted, and it was one they couldn't afford to lose. The future of countless lives depended on their actions. The hospital buzzed with activity. The corridors were filled with the sounds of beeping machines and hurried footsteps. Doctors and nurses, their faces masked, moved with a sense of urgency. Every second counted, and every action could mean the difference between life and death. The fear in the air was palpable. It was a silent, invisible enemy they were fighting, and the stakes were incredibly high. Arjun watched as Priya briefed their team. Her voice was steady, but he could see the strain in her eyes.
"We need to be vigilant. Early detection is key. Every symptom, no matter how minor, must be taken seriously. We need to trace every contact these patients had, isolate them, and test them. It's a race against time, and we can't afford to lose."
Arjun saw the fear in the eyes of the nurses. They were exhausted, yet they pushed on, driven by a sense of duty. They had families, loved ones. Each of them carried the weight of their personal lives into the hospital every day. They knew the risks as well as he did, but they stood there, ready to do their duty. Their resolve was unshakable. He thought of his wife, Maya, and their daughter, Anya. The thought of them gave him strength, but also a deep sense of longing. He had promised them a movie night. Now, he didn't know when he'd be home. The uncertainty weighed heavily on him, but he knew his place was here, fighting this battle. Days turned into a blur of endless activity. Arjun barely slept. He was on the phone constantly, coordinating with hospitals, labs, and government agencies. The city was a beehive of activity. Health officials fanned out across the city, tracking down every person the infected individuals had come into contact with. Public service announcements blared on television and radio, urging people to be vigilant for symptoms. Schools and colleges were shut down. The city was holding its breath. The initial response was swift and coordinated. But the virus was cunning. It was already out there, spreading silently, invisibly. The news hit like a bombshell. The first confirmed case of the new monkeypox strain in the city. Panic gripped the city. People were afraid to leave their homes, afraid to touch anyone. The streets, once bustling with life, were eerily deserted. Shops were shuttered. The air was thick with fear and suspicion. Hospitals were flooded with people, some genuinely ill, others simply terrified. Arjun watched the news reports with a sinking heart. The fear was understandable, but it was also their biggest enemy. Fear bred chaos, and chaos would only make their job harder. The phone slipped from Arjun's hand, clattering to the floor. His blood ran cold. Maya's voice on the other end had cracked with fear. Anya had a fever, a high fever. He raced home, his mind a storm of dread and denial. He found Anya in her bed, flushed and burning with fever. Her eyes, usually sparkling with life, were dull with illness. The telltale rash hadn't appeared yet, but Arjun knew. He knew in his gut that this was it. His daughter, his little Anya, had contracted the virus. The world around him seemed to crumble. He was a doctor, sworn to heal, but his own daughter, he felt helpless, terrified. Arjun found himself torn. His duty was to the city, to contain the outbreak. But his heart ached for Anya, his little girl, now quarantined in her own room. He threw himself into his work, desperate to find a cure, a treatment, anything to help Anya and the countless others battling the virus. He barely slept, fueled by coffee and fear. The guilt was a heavy weight on his chest. He was needed everywhere, yet he couldn't be with Anya. He could only hope and pray that she would be strong enough to fight the virus. The fight against the virus was a relentless battle. The healthcare workers were exhausted, stretched thin, but they fought on. They worked around the clock, driven by a sense of duty, a desperate hope. Vaccination efforts ramped up. Lines snaked around city blocks, people eager for protection against the invisible enemy. It was a race against time, a desperate attempt to build a wall of immunity against the relentless tide of the virus. Arjun, despite his own personal turmoil, worked tirelessly, his every action fueled by the hope that they could turn the tide. Slowly, painstakingly, they started to gain ground. The number of new cases began to decline. The vaccination campaign was working. People were recovering.
Daddy, look, I'm feeling better.
One day, Arjun walked into Anya's room and found her sitting up in bed, a faint smile on her face. The rash had faded, the fever broken. She was weak, but she was recovering. Relief washed over him, so profound it almost brought him to his knees. Anya was going to be okay. They had won this round. The city slowly began to breathe again. The streets filled up, cautiously at first, then with increasing confidence. The scars of the outbreak remained, a stark reminder of the fragility of life. Arjun, his face etched with fatigue, but his eyes shining with newfound hope, watched the city come back to life. They had faced a formidable enemy and emerged victorious, battered but not broken. The outbreak had been a stark reminder of the importance of preparedness, the power of collective action, and the unwavering spirit of humanity in the face of adversity. They had learned their lesson. They would be ready next time.